More than 130 child care centers in San Diego County had lead levels above the state's baseline. That's 5 parts per billion. In California, 1 in 4 centers tested so far had these elevated levels. A new interactive map on kpbs.org lets people look at the results themselves. It has data through April from San Diego County child care centers. Facilities that find these high levels must correct the problem. A state law required them to test for lead by January of this year. The CDC says there's no safe level of lead, so what if it's found in drinking water? We talked to a medical toxicologist who says there's no simple answer.
If you're like, well, my kid went to this daycare for 2 months 6 years ago, and I don't really know what to do about that, it's a conversation ultimately to have with your pediatrician.
Dr. Justin Seltzer is a medical toxicology fellow and emergency room physician with UC San Diego Health. He says lead poisoning that requires immediate intervention usually doesn't come from drinking water, more like old paint or other types of prolonged exposure. He says in toxicology, there isn't a true threshold dose for what might cause negative effects from ingesting lead.
I can't say, well, you had 87,000 particles of lead oxide, and therefore this is what you're going to determine, right? So I can't get us there, and we don't have that kind of information. But what we do know is that the longer and more intense the exposure, the higher the likelihood you're going to develop the things that we're talking about. So those are neurobehavioral abnormalities, which you mentioned. Those are kidney problems and cardiac problems. Kids can develop hearing issues, delayed language development.
Seltzer says when it comes to potential lead exposure, the total picture needs to be looked at. How long someone might have been exposed, did it come from a source of water that was regularly used, and what were the potential exposure levels? A pediatrician can then determine if a blood-drawn test is necessary.
Because if they say, well, you were only at that daycare for 1 day a month for 2 hours, yes, I understand the daycare was a problem, but, the likelihood of having a huge exposure is low, and we're not going to do anything about it because you don't even go there anymore. Versus you spend 8 hours a day, 5 days a week there because both parents work, and you've been going there since you were 2 years old, and now you're 4. That's a very different person and a very different conversation.
State officials told KPBS if a daycare finds lead levels higher than 5.5 parts per billion, they need to immediately stop using the water source. If they want to keep that sink or drinking fountain, facilities have 30 days to make repairs, replace it, and retest. California law requires child care centers built before 2010 to test for lead. Matt Hoffman, KPBS News.